Hello, my name is Tanya Phillips, and I am going to present to you today on the Jackson County Community Health Assessment findings for GPH 732. The process that was used for this community health assessment began with selecting a community of interest and then selecting a community health process model. For this class, I used the Mobilizing for Action Through Planning and Partnership, also known as MAP. Next, we gathered community data looking at socioeconomic status and demographics of the community and also doing windshield surveys and interviews. Next, we gathered information on the community's health. Next, we identified priority health concerns of the community by analyzing the community health data and comparing it to the state and Healthy People 2020. And then the next part of the process will distribute the findings. So the MAP process that was used the most was phase 3 of the assessment. This is the data collection process of the model. Secondary data was collected and used the most, and this is our quantitative data. So reports that were used were from the CDC, Orpheus, which is an epidemiology communicable disease collection and reporting system for the state of Oregon, the Jackson County website, Census Bureau information from the Oregon Health Authority, and county health rankings. Primary data collection consisted of our qualitative data, which I mentioned we used our windshield survey. This was done in track 1 of Medford, Oregon, and then we also I did interviews with Oregon State University and Jackson County Public Health Department. The data was assessed by doing side-by-side comparisons to the state of Oregon and Healthy People 2020. Jackson County, Oregon is located in southern Oregon, and it is the 6th largest county by population. Jackson County has a population of 216,527 people, and this was reported in 2016. Majority of the people living in Jackson County identify as white with 92%, and the second largest racial group is the Latino population, representing 12.5% of the population. There are more females living in Jackson County than males, and the average age in Jackson County is 42.8 years of age. There is 19.4% of the population who experience living in poverty, with women and children experiencing poverty at higher rates than males. Children in Jackson County have higher rates of living in poverty than compared to the state, with 25% for Jackson County and 20% for the state. Also, 62% of the children are eligible for free or reduced price school lunch prices. There are a little over 87,000 employees in Jackson County, which is approximately 58% of the population, and this is below the state's labor force, which is at 62%. Unemployment for Jackson County is at 6.9%, and this is higher than the state average of 5.7%. Women earn less than their male counterparts in Jackson County, with the male salary is at a little over $46,000, and the female salary is above $39,000. Jackson County was once known for its timber industry, but now it is diversified the economy in Jackson County. Currently, healthcare is the #1 largest employment group in the county, with Asante Health System and Providence Medical System. The second largest group is looking at retail and manufacturing, and this includes Harry and David and Amy's Kitchen. And third is government, with the 3rd largest employment group. The marijuana industry is becoming popular in southern Oregon as well, with Jackson County has 30% of the marijuana producer license. And this is combined with Josephine County, our neighboring county, which then it will equate to 50% of the marijuana producer license being in the state of Oregon. And data shows that between these two counties, the majority of marijuana is produced in southern Oregon. Having a safe community impacts physical and mental health. Jackson County experiences more violent crimes per 100,000 population in the state. Housing is also an issue, with only 1.87% renter availability. And currently, according to the Housing Authority and access, 70% of individuals' income is being spent on housing, which it is recommended only 1/3 of someone's income to be spent on housing. Clinical care in Jackson County, they rank 15th in the state. They've improved their health insurance coverage overall since the Affordable Care Act. Jackson County ranks 24th in the state looking at health behaviors. So 11th graders in Jackson County have a higher past 30-day use for tobacco, marijuana, and prescription pills compared to the state. There are more adult smokers in the state of Oregon, and there are more women that are pregnant that smoke in Jackson County compared to the state as well. The state has about Jackson County has about a 14% rate for pregnancy. Women are smoking during pregnancy, and the state average is 11. Teen pregnancies are also higher in Jackson County than the state average. What is more concerning is that the disparities in Jackson County. So there are 21.3% pregnancies per 1,000 population, but looking at the Latino youth, they experience 51 pregnancies per population. Sexually transmitted infections are becoming a public health crisis in Jackson County, and I'll go over that more with it being a priority health concern. Jackson County ranks 24th in the state on social and economic factors. Jackson County has a lower graduation rate compared to the 2020 Healthy People goal. And what's even more alarming as well is that 64% of the population for our Latino youth, that's their graduation rate compared to 75% for all of the county. Suicide rates are also high in Jackson County, along with unintentional injuries, being the 4th cause of mortality in the U.S., and intentional injuries are ranked 10th, and Jackson County also sees mere rankings as well. Jackson County ranks 32 out of 36 on the National County Health Rankings for physical environment. Areas that influence the physical environment are air quality, water quality, and severe housing problems, long commutes to work, and driving. Looking at the priority health issue in Jackson County, I've identified sexually transmitted infections. Chlamydia increased over 8% from 2015 to 2016. Females represented 69% of those cases, and 81% of those cases were in their teens and 20s. Gonorrhea had an 84% increase. Males represented 52% of those cases, and overall 79% of the cases were in their 20s. Early syphilis rose 38%, with males representing 75% of the cases. Those males were 30 to 60 years of age. Sexual orientation is high among men who have sex with men. There were female increases as well, which is always a concern because this leads to congenital syphilis. Risk factors include unprotected vaginal and anal and/or oral intercourse, the number of sexual partners, men who have sex with men, illicit drug use, hookup apps, and lack of public health funding. And also yearly sexually transmitted infection testing. It's recommended at least once a year for these high-risk groups. Resources in Jackson County is that they do have a sexually transmitted infection clinics. These locations are at Jackson County Public Health, Planned Parenthood, La Clinica, and Rogue Community Health. Other resources that are available is that between the Health Promotion Program and Communicable Disease Work. These two programs have recently applied and were awarded a 5-year grant that will allow the county to concentrate on improving STI rates, including HIV. Jackson County also receives funding for comprehensive and medically accurate sexual health curriculum and have high teaching standards for the state as a whole. Jackson County also has a regional health equity coalition, and this coalition is in place to identify high-risk groups and be able to reduce those burdens, health burdens. In summary, Jackson County has issues with socioeconomic status, with high poverty rates and low graduation rates. Health outcomes and behaviors still of concern for the county is tobacco use by adults and tobacco use by women. As you can see, the graph on the right shows that Jackson County has more pregnant women by percent smoking tobacco than compared to Oregon and the U.S. as a whole. But sexually transmitted infections, because of the increase and the steady increase, is that priority health concern. Again, chlamydia, gonorrhea, and early syphilis have all seen increases. Population at risk, or men and men who have sex with men. Behaviors are unprotected vaginal, anal, and oral sex. The number of sexual partners, MSM, illicit drug use, and utilization of hookup apps. And public health funding is always a concern as funds are continually reduced. It makes it harder for local public health to address sexually transmitted infections.